welcome everybody. My name is Gemma Todd. I work for Kingswood Group, which is an HR solutions organisation based here in Essex. We specialise in HR services and consultancy, and we also specialise in HR and office and finance recruitment. So we are absolutely delighted today to be able to welcome you to this first in a series of wellbeing seminars with our esteemed Sue Porter, who I will leave to introduce herself in a minute. Just to let everybody know, we've got about 45 minutes or so together. We're going to have plenty of time to ask questions at the end. If you do hear anything during the course of the presentation that you would like to ask Sue a question about, you can pop it into the meeting chat, and we will be monitoring that. So that's myself, the royal we, that will be myself, and also Taylor, who works alongside Sue, and we'll put those questions to Sue at the end. And then of course we will then give you the opportunity at the end to unmute yourself and ask any questions that you have then as well. So without further ado then, I would like to hand over to Sue to introduce herself.
Hi everyone, I'm Sue Porter. I'm here today as the founder of Wellbeing Clinic, and working in conjunction with Kingswood Group. I'm delivering the session on how to create a wellbeing strategy. So this is very pertinent at the moment, especially because we're into the new year and a lot of organisations are looking at how they can support their employees with their wellbeing. So my background is as a medic. In Wellbeing Clinic, we essentially support people with their private medical needs, but we also, from a corporate perspective, do health education sessions for organisations so that they can learn about how to keep their wellbeing on track, whether that's from a mental health or a physical health perspective. We deliver training and seminars for that as well. So as Gemma said, this is the first in the series. Talking about wellbeing strategy. So when we're ready to make a start, Gemma, if that's everyone added.
Yes, everyone's in as far as I can. If anybody turns up now, I'll just admit them, Sue, but you can just carry on.
Wonderful. Okie dokes. So first of all, I'm just going to run through what we're going to talk about in this session today. So we are going to look at what is a wellbeing strategy, and what should it include. So it may be that you've got one already within your organisation, and it would be good to know actually if you can pop in the chat to see how many of you currently have a wellbeing strategy in place, or whether this is something that you're new to doing, and therefore I can focus on a lot more around what your wellbeing strategy should include. We're also going to look at why do we advise having a wellbeing strategy? Why is it important? What does it do? How does it work? How do you measure it? And what benefits does it have to your organisation? We're going to look at where to start with your wellbeing strategy. And we're going to look at how to review the effectiveness of it. Much like any strategy, it's important that we make sure that it evolves with the organisation, and that we change it as it needs to be updated. It shouldn't be a stagnant document that just sits there. It should be lived and breathed by the organisation. So we're going to talk about how to make that and how to instill this into the culture of the organisation to benefit everybody. And then it will be good to get your questions, but also any kind of feedback or thoughts and ideas or information about what you've done in your wellbeing strategy. We have a 15-minute question and answer session at the end. So if there's absolutely anything burning, you can ask, but there is a designated session at the end as well for you. Okay, so just trying to move my slides through. There we go. So what is a wellbeing strategy? So a wellbeing strategy essentially sets out what an organisation should do in terms of how they manage the physical, mental, social and financial well-being of its people. So these four are typically known as the 4 pillars of well-being, and they're the key components of what makes up well-being in an individual. So the physical, the mental, the social, and the financial. So the wellbeing strategy recognises that all of these aspects are important, and that the way that the leadership team and managers behave should encapsulate what that strategy sets out, and they engage with their workforce accordingly, and so that can have the most optimal effect on their employees' overall well-being at work that it can possibly do. So key areas of the strategy should include things like the management. So by that, I mean how leaders and line managers in particular live and breathe the strategy so that it transcends down like a golden thread throughout the whole organisation. So how are we making sure that those elements of the wellbeing strategy are incorporated into one-to-one conversations, into team meetings, into the way that the organisation does business and works. It really has to fit into the culture, which is the way we do things around here. So how are we incorporating wellbeing into the way that that organisation works, so that not only is it attractive in terms of recruitment and retention of new and existing staff, but it also really means that the organisation can start to see the real benefits of having an engaged, healthy workforce that is glad to be there and glad to have these wellbeing elements within their employee benefits package. It should also include what remuneration looks like, so what people are getting in terms of their well-being. So what's in it for them? What skin in the game do they have? It looks at how the organisation manages stress management and absence management. So what should you do if, for instance, somebody is off with stress? How do you manage that? How do you manage keeping up conversations with them? How do you manage the back to work or amended duties, which often people return to work on, like duties, for instance? How do you go about managing absence, and how do you engage with your staff, if at all, while they're off? What does work-life balance look like for your particular organisation? Do you have flexible working in place? What are the working hours? What happens if someone has an appointment that they need to attend, or something in life that occurs? How do they manage that? And that's a really key, attractive element of the wellbeing strategy to both new and existing staff. What does the organisation do to support physical fitness in the workforce? Is it that, for instance, gym memberships are subsidised, or are you encouraging staff to conduct exercise at lunchtime or before or after work, or are you enabling that with having facilities like showers and things in place? And how is mental health supported within the organisation? Do you have a team of, say, mental health champions that are looking out for each other? Do you have people that are trained in spotting the signs and symptoms of mental ill health that people are happy to have a conversation with? Is there a culture about speaking up about mental health, and how could you introduce that? And how are those conversations supported throughout the journey of a mental health condition, in terms of supporting an individual, whether it's in conjunction with occupational health or just via the line manager? Just looking at all these key components. There might also be areas of the strategy that are unique to your organisation. So you might have things in place already that are quite unique perks, and you explain within the strategy how they work and how they're enacted to become living and breathing within the organisation. So why do we advise having a wellbeing strategy? So obviously, talking from an HR perspective standpoint, the reason why this is so important, because as we know in business, what gets measured gets done, and what doesn't get measured gets forgotten. So the first key point of a wellbeing strategy is to acknowledge that wellbeing is everywhere. It's intertwined with all the other strategies within your organisation. In fact, you can argue that the wellbeing strategy is the most important of all the strategies, because businesses are run by people. We all have our own health and happiness and our own physical and mental health. So if we're not prioritising that, then how can we possibly prioritise other strategies, like, for instance, the finance or the marketing strategy, if it's being led by people that don't have good physical and mental well-being, for instance. So it's a really key strategy. And one thing that really kind of gets my back up is when people say, oh, well-being, that's quite fluffy. And it's like, no, it's what defines the culture of your organization, the health and well-being of your people, and how effectively your business performs. So for me, it's absolutely imperative that organizations must prioritize this and bring it to life. So in terms of thinking about that from a business perspective, and why from a financial benefit, not just the duty of care that an employer has over its employees, which is obviously a very important legal responsibility that they have and should support their staff anyway in that, but is some additional data as to what you might get out of having a wellbeing strategy. So there was a study done by Deloitte that was called the Stevenson Farmer Independent Review of Mental Health and Employers. And what it concluded was that the cost of presenteeism, absenteeism, and employee turnover, which was purely due to just poor mental health, so not looking at the physical health side of things or the financial health, for instance, which is also important, has a cost of £8 billion a year to organisations, just to absenteeism, and then between 17 and 26 billion pounds in presenteeism. So that's working whilst you're unwell. You're going through the motions of going into the office, but you're not actually doing anything or much at all because you're unwell. And another 8 billion pounds due to employee turnover. So that's purely just for mental health. So think about the benefit that that could make to your organisation of X number of staff if everybody is so much more well in themselves, both physically, mentally, and financially, for instance. So there's a lot of data, and you can start to formulate your own data around this. So it'd be very easy if you already capture HR data around sickness absence, for instance, or presenteeism and absenteeism, and that's equated to a cost in terms of how many business days are lost per year. Once you implement the strategy, you can see how that changes on an average. And what most organisations find is that drops quite significantly, usually by about 10 to 15% for the average industry. So that can be a massive amount of money to businesses when you think about your people are obviously generating income, either whether they're because they're in the front of the business or the back office, it's serving a purpose, and that has a cost. So it would be useful for you to all track and formulate your own data to support the why of your organisation. So for those of you that haven't got a wellbeing strategy in place in your organisations, the place to start is the why. So why are you doing it? Why is it important for your organisation? It may be that the reasons that I've just gone through are very kind of pertinent, and you've got the reason, the rationale to basically say to the leadership team or to say to other directors that this is why we need to do this, because of these metrics we need to improve on these things like sickness absence, presenteeism, absenteeism. Our staff want it. They might go to another job elsewhere if we don't put something in place. So there's a lot of reasons as to why. And that's kind of your kind of burning platform of why you need to do something. Although it's not essential to have a budget, there's a lot of kind of really important key work that you can do even without incurring any cost or just very low cost within an organisation. So the budget isn't imperative, but think about what budget you could allocate to this, even if it's just a small amount just to get started with, say, for instance, training or signage or something like that. But don't be put off if you don't have a large budget that you could use, because you don't need to spend a lot of money to get this right. Then think about what are the employee needs. So you may have an idea if you have quite an open and honest line of communication with your employees, whether it's by one-to-one conversations or whether it's an employee survey, for instance, or whether it's just people articulating that, oh, I'd really like this within the organisation, or can we look to get showers, or can we look to get a gym within the organisation or something like that. What are the employee wants and needs? If you don't know what they are, then it's a really good thing to do to consult with them. So you can either do a confidential survey, or you can do just your normal annual employee survey, or you can do suggestions in a Dropbox of what people want and need in terms of their well-being. And that's quite engaging as well, because people feel listened to, which is really important in terms of thinking, actually, we care about how you feel and what you want, and we're going to look to try and introduce as much of that as possible. So it's a really nice thing to do. And then think what the business needs are. So is there a business need to reduce sickness absence? Is there a business need to improve performance? Is there a business need, or is it in one of your strategies that you want to grow the business by X amount? And how does this wellbeing strategy support that? So looking at it from a business perspective as well. And a lot of organisations find it useful to have a steering group, or a group of people that have this within the realms of their responsibility, to formulate and devise, via engagement with the organisation, what the wellbeing strategy looks like, and make sure that it's steered in the right direction of coming to fruition and actually being put into place and evolved with the organisation, and that becomes their responsibility. So it's a really good place to start. And if you've already got a wellbeing strategy and you haven't considered some of these elements, then it's a great time to revise the strategy. As I said at the beginning, it shouldn't just be a document that sits there or that's done once. It has to be reviewed every year, sometimes more frequently than that, depending on obviously the amount of change within your organisation. So when I talked about the kind of data within your organisation that you can use to kind of set out that why, some of the things to look at are things like the sickness records. So look at the previous years, collate those number of sick days that were lost, look at what that equates to in terms of cost, look at whether you have some employee wellbeing tools in place. So do you have, for instance, an employee assistance program or EAP, or do you have a counselling service? And look at the reports for those. What's the uptake? We often find that employee assistance programs have less than a 10% buy-in, and that may be because they're not needed, but more likely it's that people either don't know they're there, or they don't trust that they're confidential, or that they don't think when they're in a crisis or suffering that actually it's a good time to call this number because they can help with that. So it's making sure that's really accessible and that people trust that that's there and it's going to work in the right way for them. And if you're getting reports of counselling services from them, obviously not the confidential details about the conversation, but are you getting information like, for instance, that stress and burnout were a problem? Or are people, worried about their anxiety levels? Or does there need to be more work-life balance, for instance, because people are getting stressed about managing their personal responsibilities as well? So just look at the feedback from that to allow you to think, how can we change this to support this for our employees, but also to ultimately benefit the organisation as well? Have you got engagement and surveys in place already? Or how can you tailor the questions within those to be more focused on employee well-being? Can you update them? Can you review what needs to be changed at them? And how does the data change when you implement the wellbeing strategy? Look to see how things have improved. And if you feel like they've not improved enough, then obviously that's time to then review the wellbeing strategy again and say, right, what else do we need to do, for instance? Health risk assessments are often in place legally because of that duty of care of the organisation. So have a look and see whether they're providing information about your employees. Do, for instance, the occupational health surveys when employees often start within organisations give you any insight into the categories of ill health conditions that people suffer from. I've worked with organisations before that have a lot of people that have musculoskeletal problems and migraines, for instance, and they actually change the whole amount of money that they spend on desks, sit-stand desks and lighting within the organisation to reduce the amount of days that people take off for migraines, for instance. So if you know that's something that's relevant to your staff pool, then that's obviously something to focus on. Another option that some organisations do is just really open and transparently say, we want to be better at wellbeing. Can we have some volunteers that want to be interviewed to find out what we can do, and that you're our kind of ears to the ground of what can be changed and what ideas you've got, and they do it via an interview way. So whatever's right for your organisation or you feel fits with your culture. So we like to kind of break down what should be included in a wellbeing strategy into these 3 levels, which are different levels of intervention. And the reason why this is important, you've probably all heard the analogy of the company that just kind of brings in an exercise bike that crushes fruit into smoothie, and they've ticked their wellbeing box because, you know, you can spend 10 minutes on this bike and make a drink. Obviously, that's not going to cut the mustard in terms of people's overall mental, physical and financial well-being, to name a few, especially not in the long term. So have a think about what you're doing from a primary intervention point. So that's tackling the root cause of the issue. So that's looking at that data that we just talked about, finding what is of particular concern or issues to staff currently, and what then becomes the responsibility of the organisation to resolve. So these are kind of cultural root cause wicked issues, if you like, that need to be spent quite a bit of time thinking about how you can change them fundamentally to improve the well-being of your organisation. The secondary interventions aim at actually directly helping employees deal with situations that may be causing stress or other physical health problems, for instance. So this is, you know, what have you got in terms of a workforce to support, or mental health first aiders, or line managers that are trained in having conversations about ill health, those kind of things. So that's what, you know, what is in place for employees to actually help on the ground with situations that may arise. So for instance, if someone comes into work visibly distressed, do they just kind of sit at their desk and people not know what to say? Or are there people that are trained and skilled in saying, you know, let's go and take 5 minutes and have a quick chat or have a coffee and see if we can do anything to help you. Then we've got the tertiary interventions. So these focus on improving the way that employees engage with their well-being. So they're usually quite easy to introduce. They're often like visible things like signage to say, at lunchtime today, we're doing a talk on this. Or did you know you get a cycle to work benefit? Or, you know, that you get X amount off at this gym. Or we want to encourage you to have conversations about your health within your one-to-ones, or something that's a visual way on the intranet of saying this is what we're doing to support your well-being. So that tends to be, for instance, that would be the exercise machine being wheeled in at lunchtime, for instance. It's quite an easy thing to introduce. It will make a difference, but obviously if the fundamentals aren't there in terms of the strategy, the culture, the leadership buy-in, and the staff in place to support those conversations, then nothing's going to change. And that's why it's important to think about what you've got in place at these 3 different levels of intervention within your wellbeing strategy. And you must have all 3 for it to be successful. So thinking about what the wellbeing responsibility is of the organisation and how that's delivered from the strategy into the organisation. So from an organisational level, you've got your strategy, you've got your policy, you might have trainers in place, you might have people that are happy to kind of facilitate the delivery of the wellbeing strategy. You've got your health and safety responsibility and your occupational health responsibilities, and you've got management standards that you have to adhere to legally as well in terms of health and safety. There's key things that you have a duty of care over as an organisation, and that you may also have because of choice, like for instance the policy or the strategy in place to supplement those as well. Then you've got the managers who are going to conduct those one-to-ones that are going to build rapport with staff teams. They should also be trained in spotting the signs of mental ill health and how to open up conversations and how to manage conversations about both mental and physical ill health. They should be trained on how reasonable adjustments should be made to workplace when, say, for instance, someone is signed off sick and then returns to work. Have training around how you can make reasonable adjustments to different roles and how they can signpost, because obviously they're not going to know everything, but how they can signpost people to, say, for instance, to the employee assistance programme or to a counselling service or to even independent external charities, for instance, like Samaritans or Shout, for instance, that people can talk to or text, or their GP, for instance, that they know to say, look, you need to go and have a conversation with these other professionals about this. Then you might have your employee champions that sometimes wear a different colour lanyard or make themselves known to the organisation that they're the go-to person for support. So they're the ones that are on the ground instilling this culture of well-being, that are looking for signs, that are signposting, that are knowing that part of the remit of their job is to basically serve as a supporter of other members of staff, to obviously bring that strategy to life. And then not forgetting, a lot of organisations forget that the employees have a key role in this. You can't just kind of do to people. They have to kind of buy into it and want to do it as well. It's important to remember that they have a duty of care for their own health. They obviously have a responsibility to have one-to-ones with their line manager, and then they also have to be a compassionate colleague, and that they should kind of live and breathe the values of your organisation or what you set out in terms of behaviours that you want from your people, so that obviously that will then mitigate at the source any kind of problems around kind of bullying or harassment or things. If people understand that they've got a duty for care and to act in a certain way within the organisation, and to act in a certain way in terms of their one-to-ones as well. Okay, so how to review the effectiveness of your organisation's wellbeing strategy. So I wonder if you want to pop in the chat, whether, if you've got a wellbeing strategy, have you ever reviewed the effectiveness of it? And if so, how have you done that? Because what we find a lot of the time is that some organisations have got a wellbeing strategy, but they've never reviewed it or said, is it effective? Is it doing what we want it to do? So I just wonder, have you got, for instance, key performance indicators allocated to your wellbeing strategy? If anyone wants to, Gemma, if you let me know if anyone wants to kind of engage with that question in the chat.
I will. At the moment, so, yeah, it's just a couple of the things here. No formal strategy in place, no strategy, no wellbeing strategy as yet.
Okay, that's good.
So you're breaking ground, so that's what you're doing.
Breaking ground, yeah, it's always. Okay, so when you're formulating your wellbeing strategy, once you've gone through those steps of saying what's important within your organisation and what data have you got or could start collecting around assessing the effectiveness of the strategy, think about what qualitative and quantitative data, so the kind of quantitative as in the numbers and the qualitative as in someone saying, oh, it's great that we're doing all this around wellbeing. I feel, much better about, being well within the organisation or something. So it can be words as well. So what have you got, or how can you go about collecting that data from staff surveys or interviews or just on the ground conversations with staff, and see how things have changed? Like some organisations I've worked with have said, or the CEO or one of the leaders literally will go and ask 10 people how they're finding the introduction of the new wellbeing initiatives, and then literally just capturing what that random sample of 10 people have said and use that as a metric for how it's performing. So it doesn't have to be, you know, rocket science, pivot tables on Excel to try and work everything out. It can literally just be conversations with people to see how things have changed. It is good, however, to have some key performance metrics, like saying we'd like sickness absence to reduce by 5% off the back of the things that we're doing. And you could base that, say, look at industry standards for sick, which you can actually get for different elements. So you can get them for musculoskeletal, you can get them for mental health, you can get them for, you know, all other health conditions, and say, actually, where is our percentage out? You know, why have we got X number of percent of people that are having migraines, for instance? And what can we do about that? How can we get that in line with the industry standards? So rather than just saying, right, I want this to reduce by an arbitrary finger in the air, 5 or 10%, work out what those percentages are based on numbers that are realistic, that could be attained from other industry standard data as well. If something's not working, try and find out what it is and why it's not working, and even get people's own views on what can be done to improve it. You know, don't be afraid to ask people and say, oh, you know, we've got this new service in place. Have you used it? And if not, why not? Kind of thing. Or how can we, you know, change this so that it's something that you're interested in? So don't be afraid to ask your staff how they want things improved upon. And then formally review the strategy. So as well as those little kind of checks to measure those KPIs or measure people's thoughts and feelings about them, actually engage in a formal review annually, and keep senior leaders informed of the results as they change. So you could say, for instance, we've managed to achieve a 5% reduction in sickness. Ideally, we'd like to get to 10% because our competitors, you know, have much less days, and this is what we've got in mind to try and achieve that, because this is what our people have said that they want or need, or we know is going to help with that. So just make sure that it's reviewed, and remember the importance of the strategy, and how, like I said at the beginning, how it kind of dictates the effectiveness of all the other strategies in the organisation as well. So I just wanted to kind of summarise that approach, because I've kind of said it throughout the presentation. So initially, what you would do is you plan your approach, know where you are now, and that could be, for instance, not having a strategy in place, like some of you have said, and what you currently offer. So you might not have a strategy, but you might do some things that are pertaining to wellbeing that you can straight away put in your strategy and then start to build on that. And what's your vision for the future? What would you like to achieve in terms of those key performance indicators? Or whether you'd like to see, for instance, your retention change. So rather than people stay for 2 to 3 years, you might want more people to stay for, you know, 5 to 10 years, for instance, especially because of the cost of recruitment and, you know, the disruption that can cause to organisations. So think about what you want your vision to be. Agree the budget. Again, that doesn't have to be a large amount of money, but just say, right, you know, we've got a few £100 or whatever. It could literally be that amount to spend on kind of signposting, printing, training from staff that are in place already, like leaders, to say, right, to managers, this is how I want you to manage, like a one-to-one conversation with people from now on, for instance. So it doesn't have to be, you know, all kind of singing, all dancing. You know, change, and then use that resource, and saying, right, these people are going to have this responsibility, or these people are going to be involved in the steering group, or these staff are going to have a responsibility for being a wellbeing champion, and then have a look at the kind of business case and key priorities, and then the key performance indicators that you want in there. So you've got a real summary of why you're doing it, how are you doing it, how are you measuring it, and, you know, who's driving it. Obviously, in terms of developing the strategy, at some point someone will have to actually write what that strategy is and identify what the right interventions and benefits are going to be to those priority areas. So in order to do that, they must look at data first. You can't just say, oh, we want everyone to be less sick. You need to understand what's driving the sickness absence and where you want that to be, and conversations around, you know, how do we manage back to work? Is that a reason why people are taking more time off than we'd expect them to do for certain conditions, for instance? And then make sure that you know what those key metrics are that you're aiming for, and that the key performance indicators that are in place are going to keep that on track. And then launch your strategy. So as with anything, communication is key. If you think you've communicated enough, a lot of leaders say, then you have to do it 10 times more than what you think is enough. So yeah, it's not just enough to send out one email or put up a poster. You know, you've got to talk repeatedly about that you're prioritizing health and well-being in the workplace, you're doing this strategy, you want people's engagement, you know, you want to understand what it is they want, and that you're launching it on this particular day or week, and we're doing this, and you want people to engage, and literally just bang on about it, to kind of just, you know, really make sure that the launch is successful. And then that ongoing implementation. So it's not just a case of day one, right, we've launched our wellbeing strategy, job done. It's about the ongoing management of that. It's making sure it's working. It's making sure the changes are happening. It's checking in that these changes are happening on the ground, that people are doing their new responsibilities, that the conversations that you want them to be having are taking place. And that can be managed at all different levels in the organisation. It doesn't have to be, for instance, one particular person going around and listening into conversations. It can be, you know, instilled into everybody's responsibility, and then their manager to see whether actually or not it's happening. And then in terms of reviewing and refreshing, reflect on how it's going regularly. So sort of, you know, quarterly is a good amount of time just to say, you know, do we need to tweak anything? How's it going? There's no point in waiting for an annual review and then to say, oh yeah, it hasn't really been working for the last 9 months. You know, obviously you've just got to review it as you go. If it's working, great. If it's not working, change it. And then use that data to quickly assess what is and isn't working, so that you can keep improving on an ongoing basis. And if things aren't working, report that to the senior management. So that's wellbeing strategy in a nutshell, really, in line with the kind of time we've got for the talk. So I hope you found it useful. And now I just really want to kind of open that up to any questions that can be either verbal, so I'm mute. There we go, she muted me. Maybe she unmuted you, but I got muted. So yes, see, either verbally or you can.
You know. Sorry, Sue. Me and my happy clicky finger. Right. I'm not going to touch anything now.
I'm getting vibes that you might want me to stop talking.
Absolutely not. Oh, that was really good. Thank you so much. So, anybody got any questions? You can pop it into the chat, or you can unmute yourself and just ask. Maybe nobody wants to be the first one to go. Let's just see if we can unmute everybody.
We actually had some questions earlier.
Oh, great.
To share some. Yeah, so the first question was, would a wellbeing strategy differ depending on the industry that you're working in?
So that's a question for you. Good question.
Good question, yes. So would it matter depending on what industry you're in terms of what the wellbeing strategy looks like? So it's a kind of unusual answer, I guess. So sometimes it would and sometimes it wouldn't. So it can be that many organisations within totally different sectors can have very similar wellbeing strategies. For instance, the same wellbeing strategy that's in a hospital could be in an insurance company, because actually what they want to have in place could be things like reducing sickness, making higher uptake of employee assistance programs, having mental health awareness in place, those kind of things. So it could be that they're almost identical. And for some organisations, it can be a case of getting a starter for 10 from someone else to give you ideas. But what's important is that you go through those steps that we went through, so that you're not just kind of poaching someone else's strategy, because then it won't be applicable to the needs of your organisation. So it's very tempting if you're tasked with having the development of the wellbeing strategy and you've got a friend that works at another company and she's like, oh, I'll send you ours, and you're like, oh, job done, I've done that. But obviously, if you don't go, there's no harm in looking at it and getting ideas, but if you're not going through those process steps of communicating, engaging staff, looking at actual data, what's the problem, what's not a problem, what are you going to do to change it, then it's not going to make any discernible difference for your organisation. So in short, they don't have to be industry specific, but they do have to be specific to your organisation.
I've got a couple of questions that have come through on the chat. The first one is there any recommended priorities for small businesses, Sue?
Yeah, so I think for small businesses, it's really important, because you've got less staff, it's really important for everybody to be engaged with the wellbeing strategy. So in terms of that kind of communication and rollout of it, I think it's really important to engage everybody in that process. So say you had an organisational team meeting, because say there's like 20 to 30 staff, for instance, you could literally get everyone in the room and saying, look, we want to prioritise this, it's going to be great for you, it's going to be great for the business, and literally brainstorm, or whatever term we use these days, workshop in a session what's important to people. And not only is that an opportunity for the team to come together, it's an opportunity for people to really feel listened to by the leaders of the organisation to say, look, we want to improve this. What can we do? And it can be quite a useful kind of team kind of building session really in itself, because you're basically saying we care and what can we do? And you're spending time with them, listening on the ground. So I'd recommend that for small businesses. And then I think if you haven't got certain things in place because you're small and you don't want to spend loads of money on X, Y, and Z, it's really worth linking in with other small businesses to say, for instance, you're based like we are now, in a business park. We've got other different businesses around us. We could literally go along to them and say, right, we're looking to get this organisation in to speak about this topic. Do you want to come in and split the cost? And then obviously that's really good for kind of collegiate working as well. Or it could be, for instance, that you've got other industries or companies that and you kind of want to say, look, we're doing this, can you help us? Or can you send us what you've got so that we can, spend less time thinking about what it is that needs to be done and get some ideas. And then I think one thing that's really important for small organisations to do is make sure that everybody's just got a certain degree of training in basic kind of health and well-being. So by that, it could be that it doesn't necessarily mean they have to be like first aider or anything, but it means that they have a responsibility within their job description that's literally to support the people around them that they work with. And then you can enable them to do that by, say, like a short well-being course, for instance, to say, this is what we want you to do in terms of being a good colleague for noticing signs and symptoms of physical or mental ill health. Is someone hobbling today? Is someone crying today? Is someone coughing a lot? Whatever it is, to have that responsibility to care for one another. And then obviously you can equip them with the data and the signposting organisations that you want to say, right, this is what we want you to say in this instance. So say you're really struggling with something, it could be that you signpost them to speak to their GP, for instance. But it's just opening up those conversations so that people feel supported within a workplace. There's nothing worse, and we're all human, we all have days that something's gone wrong or we're not feeling well. There's nothing worse than being sat on a desk next to someone that doesn't even acknowledge it. And if you think about what that's going to do in terms of your engagement, your job, you're spending so much % of your time of your life there, and you're thinking, well, no one actually cares. And that is so key for engagement and longevity of staff in a job and performance, just caring. So I would definitely suggest that that's a quick win that you can do very cheaply in a small business.
Thanks, Sue. A couple of other ideas that other small businesses that we have worked with at Kingswood Group have done is that they've formed walking groups.
Mhm.
So they don't have a strategy as such, a wellbeing strategy, but they have a strategy with a small s that says we can form an informal walking group so that people can go out, and while they're walking, they're talking and sharing conversation, which is good for people's mental well-being as well. They tap into free resources, exactly what you were saying, Sue. Not just going to other organizations in the local area, but seeing what's available online that's free. So lots of organizations like Mind and the NHS will have lots of free resources that people can use, and that includes training courses as well. They can also involve, as Sue said, get team members involved by maybe picking a topic of the week or a topic of the month, and then using it almost like a little mini team build project to get people kind of talking about certain things. So I know that equality, diversity and inclusion that's quite a popular way of getting that to bring it to life, that they pick a topic and they talk about how does that impact on their ED&I. So you could do the same thing with wellbeing. I've got another question here, Sue. It says, what's the best way to present a strategy? Word document, presentation, etc.?
I think it really depends on what's done within your organisation already. What do people prefer to look at? Some organisations love a Word document, some love a presentation. So I think it's kind of what's the way things are done in your organisation, really. I'd adopt the same way as that, because I think if you're used to doing presentation slides and then suddenly you do a really kind of lengthy Word document, it may be that it's not engaged with in the same way because it looks different from normal. So I'd say the content is the same, so whether the words are on a presentation or a Word document, they're still the same words. So I think don't worry too much about presenting it. I think it's literally a case of just getting down what's important, and then obviously when management or leadership want to obviously review it, then it's just a case of putting it in the format that they would prefer. So yeah, don't get too hung up on making it look really jazzy. It's literally just a case of getting the right words down on a bit of paper.
Great. Any other questions? No, I think that's it. So if we can just move on to the last slide, Sue. Of course, if you do have any questions after today, please do get in touch. Sue would be delighted to hear from you, and you can contact us. The next slide hopefully should have some contact details for Kingswood Group. So you can visit the website kingswoodgroup.org, or you can email inquiries@kingswoodgroup.org if you'd like to find out more about how to develop a wellbeing strategy, or some of the ideas that Sue shared with you today, or you just want to find out more about how wellbeing could be introduced within your organisation, then please do get in touch and we will link you up with Sue. Sue, thank you so much for your presentation today. It was really interesting. Certainly learned a lot myself, and I'm sure that people will take some really good pointers away from today. Appreciate that everybody's given up of their time. We've got about 10 minutes left to go. So if anybody has any questions, anything at all they want to ask, whether it's about this or anything else, please do take advantage of that time. But if there is nothing that anybody else would like to ask, we will thank you all very much for attending. I believe the presentation has been recorded, so we will be arranging for that to be shared out with everybody who signed up for today's webinar.
Excellent. Yeah, thank you. And thank you for having me on board. And thank you to everyone for listening. Hope you found it useful. And as Gemma said, happy for you to email inquiries and to help you on your development or review of your wellbeing strategy.